Good morning, everyone. Good afternoon, good evening, wherever you are watching us from. We're live here from the 31st International Conference of the Red Cross Red Crescent Movement. This is another Red Vest Live, together with a very nice group of friends. Together, we will be discussing about caring for the carers, which can also be known as caring for staff and volunteers or helping the helpers, but all of it about talking about those who actually provide the services and how to take care of them as well. But before we delve into this topic, I actually want to invite the colleagues here around the table to introduce themselves. So René, would you mind just introducing yourself quickly to our audience today?
Thank you very much, Sophia. And I'm Renette van der Waals. I'm from the Netherlands Ministry of Foreign Affairs. And in that ministry and from that ministry, I am coordinating our work on mental health and psychosocial support in crisis response across the globe.
So I'm Elisa Chang from Hong Kong Red Cross. I'm also from the IFRC Reference Center for Psychosocial Support. So mainly in Hong Kong, I'm responsible for the mental health and psychosocial team, for domestic support and trainings. And at the PS Center, I'm mainly focusing on support given to Asia Pacific region.
Thank you, Elisa. My name is Sarah Harrison. I'm the head of the Mental Health and Psychosocial Support Technical Unit at the IFRC Reference Center for Psychosocial Support in Copenhagen, Denmark.
Thank you so much, ladies. Thank you for accepting sharing this discussion with me. And I'm going to start with you, René, because in the global stage, the Netherlands is usually recognized as a state that advocates strongly for MHPSS. It's actually a champion on advocating for MHPSS. So I wanted to hear from you, why do you think that MHPSS, and by the way, let me just put the acronym out there for those of you who are not familiar with it, Mental Health and Psychosocial Support. We often refer to it as MHPSS, so apologies if we use the acronym a little bit too much, but it comes out very naturally, I would say. So back to you. Why do you think mental health and psychosocial support is deserving of this level of international attention?
I think the core response is that this work, humanitarian work, is about people, about humans and about humanity, the power of humanity. And I think we have to recognize that any crisis in a way is a blow to our humanity, to our being a human being. You easily get pushed into the corner of being a very passive victim, receiving blows, maybe receiving support, but as a number and not as an individual, not as a family or a community. If we don't take care and look at everyone as an individual and as a human person deserving dignity and deserving the kind of support, which should not only look at physical elements, but also at psychosocial, another such word, but at psychological elements. And I think all of us have lived, among others, through this during the COVID crisis. Anywhere, even in countries where there are not so often other kinds of crises, suddenly we were confronted with what it does to you as a human being when your certainties fall away, when your future is unclear. You may become depressed, you stand under chronic stress. There are so many things that can happen to you, and we have to recognize those elements as well if we want people to be able to live on, to cope in a dignified way, to retain or to regain their ability to cope and to recover. We have to recognize also this psychological side of things. And without that, we couldn't expect of people to climb out of the crisis. We think it's so logic that it's strange that it's not always been included in any response.
Thank you so much, René. I couldn't agree more. And of course, thank you for bringing up the fact that we see a lot of figures, we see a lot of numbers, and sometimes we forget that there's actually real faces behind it. There's real stories of pain and that are not that individual alone, are the whole network behind him or her, right? So, of course, you are part of a government, so that comes with power and responsibility, and we really appreciate the work you do in bringing the topic of mental health and psychosocial support so much to the forefront of the many places where you get to interact and where you get to bring the topic. But I would like to know from a domestic perspective, and maybe, you know, looking into inspiring other governments, what actions can public authorities take to actually ensure that mental well-being is recognized as a fundamental right, not as a luxury, as sometimes it's still kind of taken as, no? But as a fundamental right, particularly thinking about frontline workers who we know are at more risk of having their mental well-being harmed.
I think the role that we see that we have to play and that we can play as a government, as the Ministry of Foreign Affairs, so working on international policies, is trying to create the space needed. This may sound a little bit vague, but if you're working in a crisis, if you're maybe a Red Cross or Red Crescent volunteer somewhere and you want to be sure to have the opportunity to also look at psychological aspects that play a role there, then you need to get your policies need to support that. The budgets need to be MHPSS inclusive, and in order for that to be able, we work at global level, and we try to ensure that this is included in resolutions, in big strategic documents, in budgets also, but also in human resources policies. This needs to be taken along from the very start, and not as an add-on, as something that's remembered afterwards, because then you can't find the space, you can't find the budget. So it needs to be taken along from the very beginning. If we want all humanitarian first responders and, for example, medical staff and other first responders, if we depend so much on them, on you, if we want you to be able to continue your work, we need to recognize that doing that work also brings a huge, enormous additional burden, because you're confronted with difficult things to confront. And but working on this as a completely separate issue is very difficult. It needs to be integrated into policies and into the recognition. And maybe, if I may say one other thing, there's still a vision about mental health is difficult to discuss. Diplomats feel uneasy. They're a bit afraid to talk about it, because with what words? How do you do that? And we have to reduce that concern. The concern is also maybe that it's something to be discussed among really specialists, experts. So we try to create the space in which diplomats as well, who negotiate resolutions, etc., know that they can discuss this and how to discuss this, and that it's feasible what they ask for.
Thank you so much, René. And I mean, it's so true, no? I mean, we do have these very high levels of discussion and negotiation, and if people are not sensitized to what it really means, no? It just translates into vague words, maybe, no?
And it doesn't link up. Thank you.
Yes. Thank you so much. Very insightful, and also recognizing that very recently the Netherlands was one of the states putting forward the resolution for the World Health Assembly for the first time. So congratulations on that as well. And we continue to count on you to continue pushing forward and inspiring other governments, hopefully. Elisa, over to you now. So you are here representing a national society, so the Red Cross of Hong Kong from China. And within your work, you actually have a dimension which is more domestic and one that is more international. So I'm going to ask you to maybe elaborate around those two dimensions, to share a little bit with us what is the Hong Kong Red Cross doing to protect the mental health and well-being of staff and volunteers and frontline workers. And also, when you do your international work, where you collaborate with other national societies from other countries, how do you translate those concerns and integrate that also in your international work?
Right. Thank you so much, Sophia. Yes, indeed, a very interesting, I would say, setup that we, in Hong Kong, we have the Asia Pacific Mental Health and Psychosocial Support Collaborative, hosted by Hong Kong Red Cross Branch, at the same time, like serving the 38 national societies in the Asia Pacific region. So we have this set up together with the Global Reference Center for Psychosocial Support and also with the regional office in Kuala Lumpur. And we found this setup really in a very interesting position because we are able to be physically close to the national societies that we are supporting and also be able to consider some of the cultural considerations when we are designing mental health and psychosocial program. When Sophia, you mentioned about caring for staff and volunteers, I would say I'm coming from Hong Kong Red Cross. We have been doing that actually for the longest time. Say, for example, in this year, we deployed several medical personnel to the Gaza hospital. Even before the deployment, during the deployment, and after the deployment, the psychologists from Hong Kong Red Cross would also providing the support and care to the delegates because it's such a unique exposure and a very challenging situation there. So that's why, I mean, this has been in our system, as Renee said, that it's been in the system for the longest time. And in the past few years, especially after we adopted the policy and the resolution in 2019, a lot of other national societies in the region have also been looking into MHPSS, and more specifically, like today, we are discussing about caring for staff and volunteers. One very good example, I would say, is actually from the Australian Red Cross. They have this independent well-being check system that it also has been in place in the volunteer management, that the disaster responding teams would receive an anonymous call from the headquarters within a month after the deployment. So someone who don't really know them will call them and to ask how they have been doing after the deployment, maybe deploying to the bushfire operation. So at the beginning, everyone who received the call would say, actually, I don't need that. I don't need to talk to anybody. But on average, the calls that they engaged in has an average duration of 45 minutes. Think about that. So it's a very good system because people don't have the stigma or the barriers of saying that I need help. It's been in the system. So we will go through it like everybody will have to go through it. So it's just make the access to mental health and psychosocial support so much easier. And some other national societies, they have also been trying to develop the MHPSS framework, and within which caring for staff and volunteers are always the component in it. And in Bangladesh, they are also developing, working together with the PS Center for the integrated supervision model, so that the supervisors, the managers, everyone in the national societies, they know how to support the frontline staff and volunteers. I think that is important because we don't want to make it as an add-on. We don't want to make it as an something that is good to have. It is a necessity. So I still remember yesterday, I attended one of the side meeting talking about caring for the deceased. So basically it's about safe and dignified burial. But interestingly, a lot of audience are asking questions about then how do we care for the safe and dignified burial team? How are we going to provide support to them? Which is so true. So during COVID, a lot of national societies have been involved in the operation. For example, our colleagues from Bhutan, they are also, the national society are also the one responding, taking care of the dead body management during that time. So it's important for them to also have this awareness and this sense of responsibility. It's our duty of care to provide support to our staff and volunteers when they are supporting various kind of humanitarian causes. So I think these are some very good examples from the region and how we have been trying to move forward and develop over the past few years.
Thank you so much, Elisa. And I think you've actually been humble because you've been doing so much more. You have a very nice team there, so I know this is definitely one of the areas that you touch upon. And I'm just reflecting on something that we didn't call it stigma, but you mentioned it and René mentioned as well. I mean, stigma continues to deter people sometimes from coming forward. Inner stigma, sometimes a stigma that we own ourselves, of actually showing our fragility, our vulnerability. So I really like the example of Australia Red Cross. I think that's a very nice one. And yes, just encouraging you to continue this amazing work. Also to say, if you want to learn more about the work of the Asia Pacific Collaborative, they are very active on social media as well. So you can find them on LinkedIn, you can find them doing lots of different pieces and materials. I think you have TikTok as well, no?
Yes, we did. The reason why we want to use the social media is also to give a platform for the national society to share their good experiences. I think it's for the peer learning, and this is a good practice. Maybe I can also do that in my national society. So yes, follow us.
And they also have a monthly newsletter where you can learn more about the work that they are doing. And now, Sarah, over to you. I mean, we're here at the international conference. The last international conference 5 years ago was a very important one for mental health and psychosocial support. We actually adopted the policy, a movement policy, resolution together with the states, and a lot of work has been done ever since. Within those two very important documents, there was a call for increased attention for the well-being of staff and volunteers. So you have been one of the people very, very involved in that work, in the backstage, before it was adopted, afterwards. So over to you maybe to help us reflect on how that was included in these documents, and 5 years on, what has been some of the outcomes of increased attention into this area.
Yeah, thank you for the question, Sophia. So this is a bit of a niche thing for Red Cross Red Crescent, but there's the Council of Delegates forum, which is where policies and decisions are discussed and negotiated, and that's internal to the Red Cross Red Crescent movement. So that's internal to the national societies, IFRC and ICRC. It's not involving the state parties. And in 2017, actually, the previous Council of Delegates conference, there was a wish to create an MHPSS policy that was internal, that was meant to unify those three components of the movement and say, okay, for MHPSS, what's our position internally, and what's going to be our position globally when you talk to UNHCR or WHO or IOM? What is it that we do as a movement? So we broke it down to those 8 areas. There's 8 statements, in effect, that are in the Council of Delegates resolution, and that's what we now call the MHPSS policy. And 2 of those statements actually relate to volunteers and staff. One is on workforce development. So that's professional accreditation, but that's also trainings, that's capacity building, that's supervision that Elisa mentioned, also going on with Bangladesh Red Crescent Society. And then there's a specific policy statement on caring for staff and volunteers as well. And that also very much came from the national societies who were saying we need to have this in our statement. If we don't put it in there, it's not going to be covered. It's not being covered in any other resolution or policy that we have within the movement. It needs to be in there. The challenge with it is that it sits for staff, it sits under a human resources department in national societies and with IFRC and ICRC, but volunteers comes under a different department. It comes under volunteer management, if that exists as a department, or it comes under programs. So we took a decision, okay, we have to include it in the mental health and psychosocial support policy, otherwise it's not going to be included in other policies. And then at the same conference in 2019, we also negotiated with the state parties, also with the Netherlands, an international conference resolution that was also on mental health and psychosocial support. And those 2 resolutions actually dovetail quite nicely. There's a lovely overlap. And it also talks about the responsibilities of states that Renette's also been through, and the responsibility of the movement. And again, there's a policy statement on workforce development and policy statement on caring for staff and volunteers as well. And then because we were able to get it into the legal documents and the high level, the diplomatic negotiations, it just makes everything else easier to then put it into our everyday work. And that means things like budgets that Renette mentioned. If you're putting in proposals, a DREF, for example, or an appeal proposal, put it in. Also guidelines and documents. And as a result of the 2019 conference, there's something called the Roadmap Project that came out of it that was looking at 5 or 6 priority action areas that were within those 8 statements that we wanted to zoom in on in between 2019 and this conference in 2024 and say, okay, we're going to start with these areas and see how far we can push them. And there was a group formed that was particularly looking at this staff welfare and caring for volunteers. And one of the major deliverables of that group that's been very cross-movement, ICSC's been there, IFRC and national societies. I think it's actually led or was led by IFRC and ICSC. It was their human resources and staff welfare departments. And they have a brilliant e-learning course now that's aimed at leaders. So senior leadership, SG level presidents, but also head of programs, but crucially also volunteer managers and heads of teams to help them fulfill their role to do the duty of care part of the caring for volunteers and staff welfare. So it's an e-learning course, and I can say that some national societies have actually made it a mandatory course for some of their leadership. If you are a manager, you have to take this course as part of your onboarding, and the same also with ICSC. It's been included in their one of their core courses in the staff welfare department. So massive gains have been made. It's freely available online. It's on the IFRC learning platform. So we encourage all managers and leaders to take that course. Yeah.
Thank you, Sarah. And also to say it is available in 4 languages besides English, if I'm not mistaken. So language cannot be an excuse. Also credits to the Swedish Red Cross, who was also leading some of that work. And to say that, yes, I mean, I've been asking different things, but some of the same things come, such as everyone needs to be involved, no? And I think also frontline workers are also maybe a little bit tired of feeling this is something that they need to do on their own. It needs to be way more systemic. So again, Sarah alluded to the importance of having this in policy documents, which was exactly the same that René was mentioning as well. So yes, we need everyone on board, and we need everyone to be, walking the talk. So it's great just to have some ideas being brought together here. But I have one more question for you, Sarah, because you are the technical lead for the technical advisors in the PS Center, and I know this is one of your main areas of work, or it's definitely one of the areas that takes a lot of attention from you, and it's not recent. It precedes even the adoption of the policy and the resolution. So do you want to tell us a little bit about that work and what maybe people attending us today can find in the PS Center website?
Yeah, thank you for the question. So you're absolutely right. Actually, the first document to do with this came out in 2008. And it was a Caring for Volunteers toolkit and accompanying training material. So this is not a new topic. I think it's more disheartening to see how little was done and how we had to get it into the key documents in 2019 to give it an extra push, and a lot's happened since then. But I would say there's various angles that we're tackling this from. One is there is a duty of care responsibility that organizations have, leadership has, managers have for your staff, in effect. And there's guidance on what volunteer team leaders need to know, how to structure a team meeting, how practical things like shift rotations. If you've got a team doing safe and dignified burials, they need to be rotated. You can't have them doing that all the time. Or if you've just got frontline workers doing consistent emergency response. But there's also things like how you do a session afterwards to sit down with the team and debrief how the day's gone. With the volunteers, the staff, and their structured sessions on how you can do that. So there's very concrete guidance for volunteer team leaders, but also managers. There's also the supervision piece that Elisa mentioned, so how we can better supervise staff, whether they're doing case management work or psychological first aid, for example, they all need to be supervised, and how you can do it as a supervisee and as a supervisor. And we've also got material that's critical for you as a volunteer and as a staff member. You are also responsible for your own self-care. And that responsibility will never go away. You are ultimately responsible for yourself. And that means that you also need to be equipped with the skills to know how to relax, how to manage stress, how to manage your own anxiety or your own fears. And there are practical skills that you can learn on how to do this. And we have material that will guide you through on how to do it in video format, but also in audio and in written format. We also have a well-being guide document that's got 25 very practical exercises to help you maintain a kind of relatively stable, positive sense of well-being, even if you're working in very tough circumstances. And I would say that lastly, this year, the World Mental Health Day theme actually was very much on the workforce and protecting and preserving and building the capacity of the workforce for mental health. And we had a big campaign with national societies in the MENA region. Specifically on this, it was looking at self-care to duty of care, the whole spectrum, with 19 different national societies. And also particularly what it means if your workplace or your volunteering location is an active conflict zone, or if it's a disaster zone, the bushfires in Australia, for example, or extreme flooding that we've seen in countries like Brazil and certainly in Asia-Pacific region, they've had heavy floods this year in Europe. So what does it mean to practice self-care when you're literally in active conflict or you're in the Gaza field hospital? So we had a whole section on that because it's not the same as you volunteering in a stable context, and that's not to delegitimize that type of volunteering and staff work. It's just different, and you need different coping skills. So we've also had a focus on that this year, as well as picking up the bigger global theme for the World Mental Health Day.
Actually, for what Sarah mentioned, like how to integrate the self-care into everyday's work of our staff and volunteers, I also have another small example to share. Like the Southeast Asian national societies are now actively looking into how to integrate psychological first aid, for example, into the first aid trainings, so that the first aiders themselves, they would also be able to provide psychological first aid, but at the same time, even before that, how to take care of oneself. Yeah. So I think that is always possible, how we can do it. In Afghanistan, last year we have the Herat earthquake. Right during the operation, the National Society also tried to integrate caring for staff and volunteers training, capacity building, and program for the staff and volunteers. I think these are very good examples how the national societies are putting all the good work or the guidance or the mandates from the PS Center into action. Yeah.
Definitely. Thank you so much. And I encourage all of you to visit the PS Center website. The majority of the materials Sarah alluded to are also available in different languages. And as she mentioned, there's different formats. There's podcasts, there's videos. So I'm sure you will find something there that will be useful for you. Yes, it's been a pleasure to host this. My name is Sofia Ribeiro. I work with mental health and psychosocial support at the International Federation of the Red Cross, and it has been really, really nice to learn a little bit more about what is being done on caring for the carers. And yes, thank you so much, and sending greetings to all of you.